Nursing students, let's talk. Hey y'all, this is Sasha Sabrosa, your new host of the Real Talk School of Nursing podcast. This is where we get down and real about prereqs, nursing school, being a new grad, and everything in between. Thank you for continuing to subscribe to the show. Share with us with your friends, classmates, and especially your cohort and underclassmen. The more you share, the more we're able to give a hand up to those that are coming behind us, pull them up into our family of fun, supportive nursing students and nurses. We don't need our young here. We want our young to be better and more badass than us. Okay, so you want to be a nurse. How do you need to get there? What are the steps? Well, you're here now, so I know you've done most of your research. So you already know the required courses are a lot tougher than some other majors. I think mostly because science is the major and it's one of the hardest ones in my opinion. Math, of course, is number one. But I'm so bad at math, my mind can't even think of any math degrees to give an example of. So anyways, not only are you doing difficult classes, you need bum-ass grades. At least you think you do. It depends on the school, what kind of system they have in place for acceptance. One of my schools that I applied for was highly point-based and extremely competitive, and there was about a 3-year wait to get into the nursing program, which to me was absolutely crazy. But it is what it is, and that's what you kind of have to deal with, knowing that you're going into this field. I had another school when I moved. I had to switch schools. And the school I went to was lottery based. So basically you do certain classes, and after you finish what they call your core classes, it's like 4 or 5 classes, then you can apply for the program. And then from there you can, if you got in, you could do the rest of the classes you needed plus nursing school. All you really needed to have was a good GPA for all those classes. And I still don't know exactly how they decide where people go on the wait list for that. Because when I got waitlisted, I was number 7, and another girl in one of my classes, she was about 152. And both of us had finished our core classes. We actually finished all the required classes, so all we needed to focus on was nursing school. We had no other classes to take. So who knows? The school I go to now is point-based off of certain class grades, your location, and community. So I believe there was one that if you attended a certain, if you were within a certain community, you got another point. And somehow I got in. So praise be. But I did apply to both of the schools that I was speaking of. I only did that to better my chances of getting in. I'm older. I'm the non-traditional student. I've been doing a lot of school. I don't have time. I don't feel like waiting anymore. Yes, I would have preferred to go to the first school, the lottery-based school, because it was closer to me and it would have been a lot easier. But the school I'm in now, they had a spring start, where the other school had a fall start, and I would have gone into the fall start because it's night and weekends. I got into the spring start before I got to the fall start. So I didn't want to wait, basically. That's what it is. So one of the biggest pieces of advice I can give you right now, if you've decided to go into nursing school, you have to change your mindset. It starts here. Even though you can get mediocre grades and still get in, there's a risk that you won't get a good grade and you have to take the class over. Is that a risk you're willing to take? And right now, school is the priority. I don't care where you are in your nursing career, school is the priority. I cannot say it enough, and it's relevant throughout the whole journey. Some events will have to be put on the back burner, or you can be like me, work your ass off, get ahead in your studying and your notes, and read ahead in the book. That way you can make the time to do what you want to do. You have a syllabus, they give it to you early, so you know exactly what you need to do. If you have a wedding or some event, family event that you want to go to on this weekend, look at your syllabus. What do you need to know and what can you read ahead on so you can go to this event? It's just about prioritizing, what you feel is important to you. And if that's important, that's important. They were important to me. I wanted to get things done so I could go be with my family. Another good thing I would suggest you do is if you have never been in the medical field, I would go shadow somebody. Shadow a nurse, a CNA, a doctor, whatever you can get into. There are plenty of programs out there that would absolutely love to take a student. It may not be a whole shift. It may just be a couple hours, but at least you have a little bit of insight as to what's going on. There's also different kinds of shadowing you can do. So you could go shadow somebody in a skilled nursing facility, something like a nursing home. There's plenty of hospitals. EMTs take ride-alongs. And those are just the ones that I know on the top of my head do shadowing. There are plenty other ones out there. Do you really know if you haven't asked? So you need to try. I would at least try it. It's worth it. And then, how do you know what you don't know unless you try? Can you take the smell of strange people's poop? Some people can't hack it. They go through everything and then they don't like the smell of poop, and that's a big deal. You smell poop everywhere. It's not like your own kids. It's completely different. Right there. That is a biggie. It's a lot of money down the drain. If you finish the program, then you go somewhere with a job and you can't hack it. Some of the programs are they can be anywhere from like $10,000 to $40,000. But even if it's on the lower end of that scale, that's a lot of money to waste on something that you don't know if you like to do. Just ask yourself, are you okay with that at this moment? Coming out of high school, it may not be the route for you. You may want to go to a party school, enjoy your college days. A lot of us have gone through it, and that's fine. You can absolutely do that. If you are wanting to start a family, it could possibly be too much. With little ones, it is definitely harder. From experience, it's much harder going through school pregnant and with a young one. I couldn't take the classes all at once. Some people can. Some people can do full-time school, work, and have a family. I know there are people out there. So it's not impossible. Everything I'm saying is not impossible. You can do it either way. But I'm just saying to think about all the stuff that you are willing to compromise and what you're willing to sacrifice. What can you teeter-totter on that seesaw about? Your family, not spend as much time with them because you're busy studying. Are you going to sacrifice your family? You're absolutely not going to see them. Are you going to sacrifice your friends? Not see them at all. There's some things that you can ease up on and take a little bit of time here and there. For me, that was family. I had to set a day. That was family day. But the rest of the time, I was sitting and studying, and I wasn't involved very much. My husband was doing a lot of the work. Then what are you willing to sacrifice? Again, some of my friends, I had to sacrifice my time with them. I didn't get to see them. it was not in the cards. I was way too busy, and the only extra time I had was with my family. It's definitely not easy. Sorry, not sorry. That's just the way it is. And it's real. So, for those in nursing school, do you know what kind of nurse you want to be? There's so many different types that people haven't even heard of. There's some that I haven't even heard of, and I've been looking for them. It's not a permanent decision. It's not something you need to know right away, but also know that this field gives you the privilege to change your specialties whenever you want and whenever you need to, whenever you can. There's no shortage of different places to go with it. There's a whole spectrum of nursing jobs, and you can go from one end to an extremely different direction than when you started. It's nice to know where you think you want to go. And like I said, it doesn't need to be decided now, especially if you're early in the program. It doesn't even need to be decided before you pass your NCLEX, right? There's people out there that never know what they want to do until they do it, and that's okay. I want you to know that it's okay. It's normal. So if you have an idea in your head way before you get into nursing school that you know exactly what kind of nurse you want to be, that's normal. If you go through the whole program, you've graduated, you've passed your NCLEX, and you still don't know what kind of nurse you want to be, that's normal. I want you to know that that's okay, and it's okay. I want you to be okay with it. I'm just saying, try to think it up. Try to figure out where you want to go. So I'm sure that we all know the typical nursing jobs. Those that are at the hospitals, the nursing homes, you have your school nurses, and your nurse educators, the professors, instructors, those that teach. Then there are those non-typical ones that can also be taken into consideration, and they seem pretty fucking cool. So there is a legal nurse consult, and those are the nurses that assist lawyers in cases that require medical expertise. So you would be going to court and giving your expert opinion on whatever case they need you on. For that, you just need a few years of acute care, 2 to 3 years, and they average anywhere from $50,000 to $205,000 a year. So that's one I never thought of. Another kind of nurse is a SANE. They are sexual assault nurse examiners. In 2020, there were only 1,339 SANE A's. Those are the SANEs that work with adults. And there were only 562 SANE P's, those that work in pediatrics on children. So obviously, we could use a lot more of them. So with that training, you would be underneath another SANE or a doctor and getting your training on the spot with them. And they make around $73,000 a year. Another thing that I think is cool, another nurse, is an infection control nurse. Now, they do work in the hospitals that I've been at least, so I'm pretty sure they're at all the hospitals. But they don't do bedside nursing that much, but there is lots of researching, planning, and educating on risk of spreading infection throughout the workplace. So there are some that will travel to different hospitals or different nursing facilities and teaching the workers how to keep the workplace clean. Because if you're not staying clean, you're literally spreading whatever germs, infections, diseases you have to your other patients. I have been somewhere where there was one patient who had C. diff. And I was there for the weekend. And by the end of my shift of that weekend, one whole hallway and around the corner were all getting tested or had tested positive for C. diff. So that right there told me that someone wasn't washing their hands when they went from room to room. So, an infection control nurse is the one that would teach you about this, how to prevent that whole circumstance from happening. And generally, like when you do your orientation for wherever you're working, they'll come in and they'll do a presentation for you. The ones that I've been in, they do really fun, engaging activities to show you how well you wash your hands, how well you're taking your gloves off. Are you on the right path? An infection control nurse makes about $84,000 a year. Another one is a public health nurse, and they're not generally bedside, but they can be. They focus more on the community, so they're community based. They try to improve the health within that community, so they will have vaccination days and come and get everyone in that area vaccinated. They'll also set up different classes for them to come in and learn about safe health practices, or like around flu season, they'll come and educate everybody on how the flu spreads, how can you prevent it. They just want that community to be safe health-wise. So they make about $40,000 to $80,000 a year. So I saved what I thought was the most fun for last, and that is a cruise ship or a yacht nurse. So for them, you need about 2 to 3 years of acute care, and their job is to travel on a yacht or on a cruise ship everywhere they go. You can dock with everybody. You can even go somewhere on the cruise ship, dock there, stay there, wait for the next cruise ship that comes in, hop on that one, and work on it until you get to the next one, and you can hop off and do the same thing. It's so awesome in my brain. I think that's so cool. It's not something that I would want to do as a mother. Shoot, I would love to. That would be awesome. Basically, you're giving first aid to people and giving medications. There's a lot of people, I'm sure, that are just motion sickness and they need help feeling better. That's pretty much the gist of it. I make it sound like you don't do much as a yacht nurse, but I don't know. I'm not a yacht nurse. It sounds fucking cool, but I am more than 100% sure that you still need to know what the hell you're doing. What if somebody has an allergic reaction? What do you need to do? What if somebody's having a heart attack? What do you need to do? What if they're not breathing? You still need to know your shit. It's a fun sounding job, but it doesn't make it any less than any other nursing job at all. So those nurses I've seen make from anywhere from $76,000 to $120,000 a year. And just like anything else, I'm sure it will go up and down depending on who contracts you out, who you're working for, which yacht you're going on. If you get on a celebrity yacht, you're making bank. Seriously. And these are just some examples from the broad spectrum of nursing that some people don't think about. There are many, many, many others. There's so many. But my point is, do your research. Try to figure it out. What do you think could fit into your lifestyle? What do you think you would have the most fun at? What do you think you could learn from the most? What is your priority in a job? And take it from there. You'll hear a lot about burnout, nurse burnout, nursing student burnout. As a nurse, I think it's partially due to nurses thinking that there's only a handful of jobs that they can do. They don't believe that they can go anywhere else. And they believe that if they go to another hospital, the same thing is going to happen. Not entirely true, but you don't have to go to a hospital. The industry is so diverse, it's crazy. You can literally do anything you want to do in this field. You can still be helping people from behind a microscope. You can still be helping people from behind a computer or a phone. And I believe that most of us get into healthcare to help people. We may have other incentives in mind, but this isn't a job you have to just go to a job. There's always meaning behind it. And everybody that I've talked to has had a story as to why they want to be a nurse. Something has happened to make them want to help either that kind of population, that demographic. When you do your research, look into what it takes, what you need to do, what certifications you need, and any additional training that you need. Again, you can shadow. They're not just for us to utilize before we get into the program. You can still shadow under people, and it may just take a little extra work on your part, but you can do it. And that is the best time to start networking. Even with this field being so big, the world is small. I know we've all heard it. It's a small world. It's true. You'll be surprised what great networking can do and who knows who. Some people you wouldn't even dream of knowing someone else or someone in another part of the field, they probably do, or they know somebody else that does. It's that small. Networking can take you very far. So look into different kinds of nurses. What other jobs are out there? Research it. What do you need to do to get that job? Network. Whoever you know in the nursing field, build relationships, build good relationships, and hold on to them. Do your research to get a shadow day. You don't know until you know. All right, new grads, I know you've graduated, but the hard stuff isn't over yet. We all know that NCLEX is next, but you're gonna fucking smash it. You're gonna kill it. So now it's time to be a nurse. So start building your resume early. If you haven't already, do it. Our nursing school helps us start building in our first semester. They give us these resume courses to go through. It's simple, but it's also helpful. And others may not do that. But if you start, when you start the program, you literally have 1 to 4 years to work on it, depending on how long your program is. If you haven't started your resume by now, that's still okay too. No big deal. It's never too late to start it. So think about this. We always hear that there's a shortage of nurses, right? That doesn't mean shit. You are still in a very saturated field. Even more so, you're in an extremely competitive field. And when they say shortage, that doesn't just mean bedside nurses. It includes all types of nurses. The shortage is coming from low enrollment numbers into programs. The baby boomers are ready to retire, and likewise, the geriatric demographic is going to go up way higher, so the need for nurses is going to rise. Obviously, almost like debt to income ratio, where your debt is your geriatric patients, and they're growing up, and the income is the nurses, and it's still low and not substantial enough to be considered ideal. Also, because of the shortage, ratios are high, and there are many states that don't have a law that states that you can't go over a certain ratio. And because of that, a lot of nurses are leaving the bedside and even the field. There are some states that require a nurse to patient ratio, and they cannot go over it. But just like getting into the program, it's just as, if not more, competitive. So dealing with that is going to take some thought and planning. Again, where do you want to be? If what you want takes some experience behind your name, make sure you're looking at jobs that will ultimately benefit you. Is it going to help you get to where you want to go? So one example, if you want to go into critical care, will home health or hospice be beneficial to you? Some may say yes, some may say no. If you feel like it will, fucking go for it. If you don't think so, let's find something else. Go somewhere that will build your skills, somewhere you're going to learn and where you're going to be able to continue growing. You got to make yourself marketable. We know it's competitive, but think about what will set you apart from the others. We're all going into this with no nursing experience, but all these jobs say that they need They're requiring a year in acute care or 2 years in clinical setting, BSN required, all that stuff. We don't have it. So you need to think about what can you do to pop on that resume? What is going to draw their eye to you? What is going to show them that they want you to work there? We know that nursing is pretty much phasing out associate degrees. Everybody wants a BSN. So if you want to start working on your BSN if you haven't already. That's something that you can show to your employer that you're working on it, and they'll appreciate it, and they may even help you. Also, look into facilities that will allow an associate's, but say something like BSN preferred or must acquire a BSN between 2 or 4 years, whatever the case may be. Look for the fact that they are willing to take an associate's degree as long as you're working towards a bachelor's. And a lot of places, if you come in, they will pay for your school to better yourself to get that degree. And that's kind of just a small loophole, if you can call it that. Another big deal is to get certifications. The easiest ones, stay on top of your BLS. You already have it. Keep it up. Then you can get your ACLS, your PALS, or NRP, things like that. Get one of them, get a bunch of them, get all of them. I don't care. Get something. This will show that you're willing to learn and you want to better yourself. It will set you apart. Let them know in your interviews that you have all intentions to get more certifications, or you can even ask them if they offer them to employees or if they'll pay for it if you go find one. Just asking that question shows them that you have intentions of doing more, learning more, and that's something that they want. They don't want stagnant nurses. They want people that are going to be on their shit, they're going to know more, and be able to do more. This kind of sounds silly to me to even say, like, why wouldn't people know this? But some people don't. But put everything on your resume, all your certifications. You can put in your clinical sites, any awards that you got in the program, any letters of recommendation. All of this will help you stick out. Be as flexible with your schedule as you can be. I understand some of us have families and children's, so being flexible is not always possible, and that's okay. But if you can't, you can't. That's fine. You'll still find something within your schedule. You'll find it. But if you can have a more open schedule, that won't limit you to what you can do. For example, night or day shift. Your whole day is open. You can work night or day. So if you find some job openings, for me, I work nights. That works for my family and it works for me. So when I'm looking through job openings, I can only look at nights. I can't look at days. And there are some times where I see some bomb-ass job and it's a day shift. I can't do it. So if you are more open, you have more possibilities. Lots of people prefer day shift because they can leave early, they can get home, and still have a late dinner, spend time with the family, or even, childcare is hard to get at nighttime. They may not have that option. So because of that, there's a lot of night shift openings as well. Night shift can have its downsides, but don't hate on it though. I love it. Sleep patterns can throw you off, but you get paid more for working at night. Shift differentials add a lot to your paycheck. I also solely work on weekends, and when you work weekends, there's another shift differential that comes into play. One time, I picked up someone's day shifts on a weekend, and when my paycheck came in, I was so upset. I didn't really realize, but I depended on those shift differentials. in my paycheck. So, wink, wink there. You don't have to worry about the suits and ties at nighttime. They're not there. It's a lot of stress off when you're not worried about someone watching over your shoulder all the time. So there's good and bad to both day shift and night shift. All I'm saying is be open so you have more opportunity. If it's not completely ideal schedule-wise, who cares? Take it. Work there for 6 months to a year and then change it. If you're in there for about a year, 6 months, you'll be able to talk to your manager, your director, whoever you need to talk to hop on a different shift, or you'll have enough experience to go somewhere else if that's what you want to do. Again, I'm not saying just take anything or whatever comes first, but if it can help you, do it. You know what you want and what you're willing to take on. If you take anything and you're not happy with it, it can very easily make you want to stop nursing altogether. But if you can't get in right away to the position that you want, make sure what you take benefits you and that you will be happy where you are to be able to gain the experience and get what you need from there. You want to be able to apply to your job and say, yes, I am new, but I'm already badass, and you would be lucky to have me. I have these certifications, I have my BSN, or I'm working on my BSN right now, or my MSN, whatever it is. I want to continue growing and learning, and I'm going to prove to you that I'm an asset. Those are just some things that are going to make you more marketable without having any experience. So you're going to keep learning. You're going to keep going for your BSN or your MSN or whatever it may be. You're going to get those certifications. You're going to make those good networking relationships so you're able to find something to get into and start working. If you're not working, you're not getting experience. If you're not getting experience, then you're not going anywhere. Point blank. So from beginning to end, you really need to ask yourself if this is something you're in the long haul for. There's lots of hills to climb, there's hoops to jump through, but honestly, it'll be worth it in the end. Think about who you want to be when you're done with school. Then prove it to yourself and the others that you can do it, and you can do it better than those other new grads. Put yourself out there and get what you want. All right, guys, reach out, ask any questions, send me any shout outs you have. I want to hear about all the good stuff, your graduations, your grades, acceptance letters, your exams, that you passed the NCLEX, that you got into the nursing program, or even if you have any congratulations to your friends, let me know. I'll share it with everybody and give them a shout out. Send it to me at realtalknursing@gmail.com, Facebook Messenger, or slide into the Instagram DMs. If you like the show, the Real Talk School of Nursing podcast is available wherever you listen to podcasts. Remember to rate us, review us, write in, and smash that subscribe button. There's only one thing that will make your dream impossible, and that's fear of failure. See y'all in the next episode.